There's this period of time after you get out of training, leave a practice, or move states, or whatever it is, whatever the reason is, and you start somewhere new in a new state. There is this period of time that requires probably about 3 to 6 months to get on insurance, to get credentialed, to get properly on paper, everything to say, okay, I can see patients. And I think with Swift, it's something that, one, you can market right away, get the word out to patients right away, and be able to start practicing, during those months where you're still building clientele base, a patient base, still trying to boots on the ground market or, virtual market. And I think it's a great way to just immediately get started, because I think every practitioner, every physician who strikes out on their own, whether right away after training or after leaving a state or another group, I think that that's top of mind, right? It's like, how do I get patients in the door right away so that I can spend a portion of the day treating patients and spend a portion of the day marketing and growing? I think that was the perfect combination of getting the word out to patients. And also, when someone comes in to see you and is a new patient, and if you resolve their problem, you can then give a little spiel. This is what I do with my new patients. I equate it to like a common cold. I say, you're going to get the first treatment today, and you're not going to see a difference, and you're going to think this is crazy. But 2 weeks from now, you'll notice that there's improvement in pain, in lesions, in just how many black dots are in your callus, and your overall skin texture. It really has shown me kind of the power of the technology. It's like, I've had people who come in with warts for like the past 4 years. They've been stuck in offices every 2 weeks. They've spent a lot of money on copays, on visits, on treatments, and things like that that just haven't worked. And I tell them, just give me at least that much of time, I would say. And then they're pleasantly surprised when it's solved way, way, way quicker than what they've been doing. Pediatric patients, oh my goodness, they do so well. They usually come in with 1 or 2 lesions. They get 1 treatment, then they hate me because it's a little painful. Then they come back and it's resolved. So Swift was able to kind of fill that void for me, which is really neat.